Good morning, everyone, and welcome. We're going to get started in about another minute or two, just to give few more participants time to join. So just give us another minute or two. We good to go. All right, we'll go ahead and get started. Thank you all for joining today. For the webinar, Preparing for Statewide Adverse Healthcare Events. My name is Jessica Ledesma, and I'm the LENS Senior Program Implementation Specialist. I'll be facilitating today's session. Before we begin, just a few quick housekeeping notes. All attendees are in listen-only mode. If you have any questions during the presentation, please submit them using the Q&A or the chat pod to all panelists. We will be addressing questions during the Q&A portion at the end of the webinar. Slides will be made available following today's session. Our agenda today begins with opening remarks from the Director of the Illinois Department of Public Health. We will then move into the LENS program overview and implementation, which will be presented by Chineri Arlu, Division Chief of the Division of Healthcare Quality and Outcomes, formerly the Division of Patient Safety and Quality. After that, we'll hear about the pilot from Erin Lawler-Hart, Patient Safety Program Implementation Consultant, followed by partner remarks and time for questions. Now my pleasure to introduce Dr. Samir Vora, Director of the Illinois Department of Public Health. Dr. Vora is a physician and public health leader with deep experience in health policy and system improvement. We are honored to have him with us today to provide opening remarks. Dr. Vora, I'll turn it over to you.
Well, thank you so much, Jessica. It's a pleasure to be here and an honor to be the director of the Illinois Department of Public Health. I want to thank everybody for joining us today, and especially our partners at the Illinois Hospital Association and the Illinois Ambulatory Surgery Center Association for co-hosting this important statewide session. This is kind of April, and in April in public health, we celebrate kind of 30 days of public health, acknowledging to all that our mission is rooted really in the idea of protecting our health today and preparing our residents for tomorrow. A key part of that goal is partnering with healthcare organizations to support safer systems of care statewide. Today, we're taking an important step in that mission as we prepare to launch Illinois' statewide adverse health event reporting program, known as LENS, Learning from Events to Nurture Safety. Now, this work has been a priority for the Department of Public Health, but really a priority for the governor's office, because LENS is about identifying patterns that no single facility can see alone, learning from them, and supporting efforts to prevent harm. LENS is designed to strengthen transparency, strengthen learning, and strengthen safety. The program's not intended to be punitive, but rather to provide the data and knowledge that will lead to improved quality of care for all Illinoisans. This has been a big effort from our staff, our partners, really to bring this idea to fruition and really create an opportunity for partnership so that we can learn from these events to nurture safety, as LENS is so named. So thank you to our IDPH team. Thank you to our partners. Thank you to all the participants on this call for their dedication to safe, high quality care for all of our residents here in Illinois. Now it's my pleasure to turn it over to Chineri Arlu, who is spearheading the statewide effort and leading an exceptional team to drive this work forward. Chineri will walk through our approach and what to expect in the months ahead. Chineri, to you.
Thank you, Director Vora, and good morning to you all. To set the stage, I just want to briefly frame LENS within the context of the Division of Healthcare Quality and Outcomes. Our division, which was formerly known as the Division of Patient Safety and Quality, works to support safe, high-quality care for all people across the state. Our work is guided by several principles. First, we use a systems approach to understand the broader structures, processes, and conditions that drive healthcare quality and safety across the state. Our work is also data-driven, and we collect and use data to support learning and guide quality improvement efforts. Thirdly, we prioritize strategies that support real-world implementation and that help healthcare facilities to make improvements that are sustainable. And finally, collaboration is really central to our approach. We engage with healthcare providers, patients, and communities to ensure that our efforts are informed by diverse perspectives and that they really meet statewide needs. And so you'll see these principles reflected as we talk about LENS today. Next slide. So as the director mentioned, we are really excited to introduce the LENS program today. LENS is our statewide adverse healthcare events reporting program. We intentionally chose the name LENS, Learning from Events to Nurture Safety, to signal that our commitment and the emphasis of this program is about learning so that we can all work together to prevent harm. And LENS is not a program about blame or punishment. Next slide. LENS was created to implement the Illinois Adverse Healthcare Events Reporting Law of 2005. While it has been a long time coming, we're very pleased that now we have the operational infrastructure and the secure electronic reporting tool needed to support consistent reporting and to support statewide learning. LENS is built around 3 core goals: reporting, learning, and preventing harm. We want to ensure consistent, standardized collection of data on serious reportable events. IDPH will review the event submissions, provide feedback to reporting facilities, and analyze data for trends and insights. The LENS program will disseminate best practices and provide resources and tools to support system-level prevention. Next slide. So now I'd like to walk us through the key elements of the Adverse Healthcare Events Reporting Law. The law requires adverse healthcare events to be reported to IDPH, and we'll go over which facilities this applies to in just a few slides. The statute also requires IDPH to safeguard and maintain confidentiality of the data that facilities submit. The other requirement is that we align with the National Quality Forum, or NQF's Serious Reportable Events, or SRE list, and to also align with the Centers for Medicare and Medicaid Services. Next, the law has specifications about when qualifying events need to be reported, and also requires use of a systems-based approach to analyze events and to act to mitigate future occurrences. We are required to publish annual summaries of events that are reported, but this must follow a 30-day facility preview period where facilities will have the opportunity to review the data that they have submitted and to request corrections if necessary. And finally, the law requires that we have a 9-member advisory committee to really work with us to inform and guide our efforts. Next slide. As required by law, we are working to update the Adverse Healthcare Events Reporting Administrative Code to align with the 2025 NQF Serious Reportable Events list, which was released just this January. Updates to the code will also more clearly define what is expected in a structured systems-focused event analysis and reflect current patient safety signs. We've included here the link to the administrative code. It does not yet reflect the changes that I mentioned on this slide, which are in process. Next slide. So in the next few slides, I will be reviewing who is required to report, what needs to be reported, and when. Next slide. This reporting requirement applies to a range of Illinois hospitals. These include hospitals that are state operated, that's point one there. Secondly, hospitals that are maintained by public universities in Illinois. Thirdly, hospitals that are licensed under the Hospital Licensing Act. Next, hospitals that are organized under the University of Illinois Hospital Act. And finally, ambulatory surgical treatment centers that are licensed under the Ambulatory Surgical Treatment Center Act. Next slide. So this slide zooms in a bit more into which facilities will need to report. We want you to walk away knowing whether your facility or system will be affected by this requirement. So we have the state-operated mental health centers, which are managed by the Illinois Department of Human Services. Next, public university hospitals, which currently really applies to the University of Illinois Hospital. The next category are the hospitals that are under the Hospital Licensing Act. So these would be critical access hospitals, general acute care hospitals, non-state or non-public standalone psychiatric hospitals, rural emergency hospitals, specialty or specialized hospitals such as children's hospitals, long-term acute care hospitals. We also have the inpatient rehab facilities and safety net hospitals. I already mentioned the University of Illinois Hospital, and then of course, ambulatory surgeries, treatment centers that are licensed. Next slide. So before we launch this program, IDPH will host additional webinars that will go through the requirements for reporting, including the reportable events in much more detail. So today, I'm just going to give a very high level overview and just a few abbreviated examples that align with the NQF SRE categories. Facilities will need to report procedural events like surgery or other invasive procedures that are performed at the wrong site on the wrong patient, or that are the wrong procedure regardless of the type of procedure or the outcome. Product or device events that result in serious harm will also need to be reported. And then some examples under patient protection events include unsafe discharge of a patient who does not have decision-making capacity, serious harm associated with the use of chemical or physical restraints or seclusion, and sexual abuse or sexual assault within or on the grounds of a healthcare setting, regardless of the outcome. And finally, there are several care provision events, such as patient harm associated with falls, medication errors, and pressure injuries. You can review the full 2025 NQF SRE report for the full descriptions and definitions. Next. So for each qualifying event, facilities will need to report information about when and where the event happened, and also the type of harm that resulted, the demographics of the patient or other individual affected. Facilities will need to provide event-specific information, including immediate actions that were taken and the outcome. These reports should not include any information that identifies individual healthcare workers or patients. Facilities will also need to submit root cause analysis and corrective action plans for each event, along with information about how the facility plans to measure success and effectiveness of interventions. Next slide. So this slide here shows the reporting timeline and just gives a bit more information about the reporting system. Within 30 calendar days of discovering a reportable event, the facility must report the event to IDPH. And then within 90 calendar days following the initial event report, the facility must report to IDPH the root cause analysis and the corrective action plan. And then an update on the measures of success will be reported after 6 months. All of this information will be reported into our a secure web-based system, reporting system that is maintained by our vendor, and I'll introduce that vendor in a few slides. Next slide. So this slide just provides some information about what happens immediately after facilities report. IDPH will review what has been submitted. We will provide feedback to the facility. If needed, we will request resubmission. I really want to emphasize that IDPH cannot and will not provide medical, clinical, or legal advice through the LENS program. Next slide. This slide here addresses a key question that has come up as we've spoken with the trade associations and other stakeholders. And I'm sure that's one of the questions that many of you have today, which is, what will IDPH do with the data? And I've alluded to some of this earlier. As shown on the left column, we will use the data to identify global patterns, system-level issues, key lessons, and effective practices that we can share across facilities to support learning. This data will also help us to target and tailor technical assistance and support where they are most needed. Now on the right side, you see listed what the data will not be used for. First, LENS is not a regulatory program. So this program is not tied to any inspection or to any licensing processes. That work will continue to be handled separately by IDPH's Office of Health Systems, which was formerly known as the Office of Healthcare Regulations. As we've noted, the LENS program sits in the Division of Healthcare Quality and Outcomes and is functionally separate. I also want to stress and reiterate that LENS is not punitive. And then the other point is that the data that we collect in the reporting system is not admissible in legal proceedings, and it is protected from FOIA. So all of the information that are stored in the system are confidential. Next slide. This slide speaks to what happens when facilities fail to meet the reporting requirements. If IDPH identifies that a facility may have failed to report an event to us, IDPH will follow up with the facility to understand and address any barriers and provide guidance to support completion of the reporting requirements. Now, if there is continued failure to comply with the reporting requirements, that's when enforcement actions may be triggered. And I really want to emphasize here that, as you see called out in the blue box, that enforcement actions can only apply for failing to report or to complete required follow-through. The enforcement is not tied to the fact that an SRE happened or that your facility reported it. Next slide. So throughout this process and continuing forward, we will be engaging with different stakeholders and continuing to seek input. I mentioned already about the 9-member advisory committee that is required by law. These members, or this committee represents patient safety expertise and also lived experience. We have also had informational calls with our associations and with some accredited bodies, and we have ongoing conversations still planned, along with the patient safety organizations, to really get their input and think about how we can reduce reporting burden on facilities and how we can align efforts. You all that are on this call today and just our healthcare facility community have multiple avenues to provide input and also send any questions that you may have. First, the advisory committee meetings will be open to the public, and so those are an avenue where anyone can participate. The dates will be posted once available on the IDPH website. We will also be having user testing during the pilot. We'll be talking more about the pilot now, but that's another opportunity for facilities to be able to test out the system and just the reporting process and provide us with feedback. Additionally, we'll be having Q&A sessions throughout the year and into next. Next slide. So now I'm going to talk about the timeline for statewide reporting. We are planning to have the pilot start this summer and through the rest of the year. And then in the last quarter of this year and into next year, we will be having a series of different trainings, as I already mentioned before, to make sure that facilities are well prepared for statewide rollout. And then we're looking at Q1 of next year, 2027, to launch the statewide reporting. And prior to launch, we will provide at least 30 days notice to facilities. So now I'm going to hand it over to Erin Lawler-Hart. She's our Patient Safety Program Implementation Consultant. She will provide a lot more detail about the pilot. Over to you, Erin.
Thank you, Canary. And thank you all for joining us. We have set aside a 6-month pilot to deeply understand how the LENS program really works in a real setting. So the workflows that you have within your healthcare facilities. And there are 3 cohorts designed, and each builds on what we learn, expanding the number of the types of facilities that are involved, and moving from testing the core functionality to testing the workflow variability and really bringing this to scale. Before each of these cohorts, we will have opportunity for the participating facilities to receive access to the platform and training. This would still be a test environment, but a real exposure to what the system would be and training around that so that we can really understand how the platform is working now and what improvements could be gained from your insights. So our first cohort there will be about 2 weeks in duration and will begin in mid-June. So this is our rapid learning phase to really expose any fundamental technical issues or usability issues that remain. And for this, we are looking for facilities that have established reporting systems and familiarity with serious reportable events already to help us surface those early defects and validate the core system rather than test the understanding of a particular definition, for instance. And so we are looking for participants in that cohort for about 3 to 6 facilities there. And those facilities can also move toward the second and third cohorts. So if they'd like to participate throughout, they are more than welcome to. That second cohort will be about 8 to 10 weeks and will begin in mid-July. This pilot cohort will introduce more variation into the systems to see how well the system supports diverse user bases, diverse workflows, different levels of experience in reporting, different geographies that might have an influence in reporting. So we're really building in that variation. And as well, the cohorts in the participants in cohort 2 can participate in cohort 3. So we're looking for 8 to 10 additional facilities in our cohort 2 to then test that variability. And looking at our cohort 3 there, this will also be about 8 to 10 weeks and will begin in mid-December to early October. this is where we are bringing it to scale. We are still testing that variation, still testing the variability, but bringing in even more facilities to really push the system under broader workloads, different scenario complexities, different reporting patterns, and nuances that we may all be familiar with as it comes to how events occur and the reporting strategies around them. So in this case, we are also going to test our training materials. How well are those training materials designed so that a naive user can look at those training materials and know exactly how to approach the system to report an event effectively and efficiently. And so here we are asking for an additional 5 to 7 facilities in our cohort 3 to add upon those existing facilities that we hope would continue through the pilot process if able. And when thinking about what is this going to take from a facility perspective week to week, what does that workload look like? Overall, it will be about 1 to 5 hours commitment per week, fewer hours at the onset, 1 to 2 perhaps per week for the first cohort, and then building those hours to up to 5 hours per week as we introduce that complexity, the scenarios, and the reporting strategies there. And in terms of the facilities, we're asking that no more than 3 would be included in a test pilot facility. That just helps to enable the management of the feedback that we receive. And that feedback that we take in and digest will help improve the system and will be reported back to you to share this is the changes, these are the changes that we've made from your feedback and the direction that has been taken. Next slide. So your participation in those real world insights that you bring will be really essential in shaping the system that works well for you, for every facility across Illinois. And so your participation is very deeply, deeply valued. If you are interested in joining the pilot and contributing to its success, an interest form is linked here on this slide and will be available. These slides will be available to you. And we'll also include the link to the interest form in the chats that you can use to express your interest. As you see there, we are seeking feedback by May 18th. And then we will follow up with those interested facilities late May and early June. So again, it's a 6-month pilot altogether. You can express your interest and identify the different cohorts that you feel that you would belong within, and also the time commitments that you could attribute to this opportunity. And your insights, your experiences are certainly valued and will help shape the success of the system once again. I'll turn it back over to you, Chineri.
All right, thank you so much, Erin. All right, so I'm going to talk about kind of what can you do in the interim, aside from potentially participating in a pilot to prepare for the statewide launch in 2027. Your facility can start reviewing your structure and processes and just your capacity around conducting systems-based investigation. And the other thing that your facilities can do is to begin to identify staff who can serve as the gatekeeper, number one. So that's what you see there listed as.
Hello all. I'm hopeful that you can hear me. If somebody could place in the chat that you are able to, oh, wonderful. Wonderful.
Yes, yeah, we can hear you, Erin.
Oh, wonderful. I will take over for Chineri. It looks like we may have lost contact with her. So I will continue the process, and she can join in as she's able. So how the facilities can prepare, what you can do is really start to evaluate your internal systems now and understand what the alignment is currently, what staff you would identify to be your portal registration authority. This is a person who would be part of that reporting process and who would submit that, or the validation of the users who would be submitting patient safety events, that reporting submission, and then participate in the training and onboarding activities that will occur later in the summer and early fall. What it isn't now is a reporting platform for real events. We are still in that, we will be approaching that pilot as mentioned. So it is not a live environment to submit real events. And so we discourage that from occurring. Next slide. Additional support and resources mentioned, we will have the training and system demonstrations of the Lens platform. We'll have additional training around root cause analysis for organizations who might benefit from that. There will be other materials that will be generated, the Lens reporting system guidance, different cognitive aids that can help users really become familiar and expert in the system, as well as the safety science principles and systems thinking resources that would be beneficial to have, if not already well versed in those areas. Of course, we'll also have a help desk there. It's by phone and online that would be available to help with any problems that you might experience or needs to navigate the Lens system. Or other questions about reporting. And we have a dedicated Lens email there that you see that is actually a live accessible email currently. And that is a means to communicate with the team here. Next slide. Additional resources that are for your digestion now in live environment. On the left, you see there is a very comprehensive FAQ. You see some of those topics there in the outline. We've built this out to share information that would be pertinent to a healthcare facility and professionals that are in that environment. Also to those that are patients and families, and understanding what this might mean for those patients and families. And then a different section that really speaks to the program, the public reporting and legal information. So I know that some of the questions that are in the chat speak to what does this mean if we report to a patient safety organization, what kind of information is made available to the public, who can report. That's all explained within your FAQ. And this is accessible through on your left or on your right there, a website that is currently live. It is recently been developed for the Lens program, and it too explains in great detail information about the Lens program, about the reporting process, the Adverse Healthcare Events Reporting Initiative and law. And then it brings that down to sections for the healthcare facilities, for patients and family, and has those FAQs as well linked there. As you receive the slides, the images here are hyperlinked to the information, the FAQ, and to the website, but we'll also place those links within the chat before we close today. Next slide. And this is our Lens program team.
Aaron, I can do this one.
Okay, great. I'll turn it over to Justin.
Hi, everybody. Justin Sinner, Assistant Division Chief for the Division of Healthcare Quality and Outcomes. As you know, you've met Chinyeri Alu, who did the presentation, a lot of the presentation, who's having technical difficulties right now with her internet. Oh, I see her pop. Actually, she might have come back here. I was just introducing the team, Chinyeri. Can we test your mic?
I'm so sorry. Technical.
Oh, you can hear you. Okay. Well, I've only introduced you. If you want to continue about the team.
Okay. Well, thank you. Pardon the logistical difficulties. Again, just really thankful for the Lens program team. This is the team that is leading and supporting planning and rollout of Lens. So we have Justin Sinner, who is the Assistant Division Chief for Division of Healthcare Quality and Outcomes. Jessica Ledesma, who you heard from at the beginning, is the Senior Program Implementation Specialist. And then on the top there, Dr. Catherine Kennard is the Preventive Medicine Medical Advisor, who is really providing a lot of expertise on this program. You heard from Erin Lawler-Hart, who's our Patient Safety Program Implementation Consultant. And then we also have another consultant, Sylvia Garcia-Houchins. And then finally, Antu Runez is our senior epidemiologist. We also have, our vendor is MatTech, and they are building the secure reporting system. I'm sure you'll be getting communications from them in the upcoming months and years. So we wanted to make sure that you are familiar with MatTech. Next slide. And so now I will turn it over to our partners to just provide some remarks. First, Jenny Winkler will speak. She's the Senior Director of Quality, Safety, and Health Policy at the Illinois Health and Hospital Association. And then she'll be followed by Melissa Rice, who is the Administrator for Loyola Ambulatory Surgery Center and also the President at the Illinois Ambulatory Surgery Center Association. Jenny, I'll turn it over to you.
All right, well, you can hear me okay. I want to start just by extending my sincere thanks to Chinieri, Jessica, and the entire team at the Illinois Department of Public Health for the tremendous work that has gone into building and launching a program that will effectively operationalize this law. Just like Dr. Vora had mentioned at the start of today's call, developing a program of this scope requires a lot of vision, collaboration, and sustained commitment, and the department's leadership has demonstrated those elements throughout this entire process. So the Illinois Health and Hospital Association appreciates the opportunity to partner not only with this exceptional team, but also with the Illinois Ambulatory Surgery Center Association to support hospitals and ambulatory surgical centers as they implement the new reporting framework. This collaborative effort represents a meaningful step forward towards establishing a statewide approach that advances quality improvement, promotes transparency, and strengthens patient safety across the state of Illinois. So we very much are looking forward to continuing this partnership and working together with everyone on the line today to ensure this program's long-term success. Thank you.
Thanks so much, Jenny, and over to you, Melissa.
Thank you. On behalf of the Illinois Ambulatory Surgery Center Association, we want to recognize the Illinois Department of Public Health for their extensive effort invested in designing and implementing the new program, supporting the Illinois Adverse Healthcare Events Reporting Law. An initiative of this complexity does not come together without strong leadership, cross-sector engagement, and a commitment to getting the details right, and IDPH has brought each of those elements to this work. IASCA also values the partnership that has emerged through this process, including our collaboration with the Illinois Health and Hospital Association. By working together, we are better positioned to help ambulatory surgical centers and hospitals understand and operationalize the new reporting requirements in a way that supports learning and improvement. This coordinated approach lays important groundwork for enhancing patient safety and consistency statewide, and we look forward to continue to work alongside IDPH and our partners as this program moves forward.
All right, so thank you so much. This really concludes the formal part of our presentation and overview today.